Hello, I am Dr. Sang-Ha Shin. At the 9th Spine Health Academy, I gave a presentation on spinal ligament reconstruction surgery. I would like to briefly introduce it here. Lumbar spinal stenosis has a reported prevalence of about 11% across all age groups. The incidence increases significantly after the age of 50. As a degenerative condition, it results from the accumulation of poor posture and lifestyle habits. I believe spinal stenosis can be prevented through proper posture and regular exercise. For first-time patients, even when paralysis is present, we usually recommend conservative treatment first if there is no bowel or bladder dysfunction. Conservative options include medication, physical therapy, oriental medicine, and injection therapy. If symptoms persist despite these treatments, surgery is considered. However, if leg paralysis and bowel or bladder dysfunction are present, even in first-time patients, urgent surgical treatment is required. Spinal stenosis can be categorized into three main types. First, if the spine is stable but nerves are compressed, we typically perform decompression using a microscope or endoscope. If there is nerve compression with moderate instability, we treat it using the midline approach combined with spinal ligament reconstruction. In cases of severe spinal instability, we choose among various approaches such as anterior, lateral, or posterior fusion, depending on the patient's condition. Traditionally, decompression for spinal stenosis involved a laminectomy, but the midline approach takes a different path. In this technique, decompression is performed from the opposite side to preserve as much bone as possible. Since the resection of structures like the lamina and facet joints is minimized, the procedure requires a high degree of surgical precision. The ligamentum flavum is removed while minimizing spinal instability. Because removing this ligament can cause instability, we correct it using an artificial ligament. As illustrated, the left nerve is decompressed from the right side, and the right nerve from the left. This allows us to preserve normal bone structures and reduce the risk of instability after surgery. In most cases, the disc is also preserved. When spinal instability is severe, spinal fusion is necessary. There are several surgical approaches. The anterior approach through the front, the lateral approach through the abdomen, the posterior approach from the midline of the back, and the transforaminal approach, which enters from 2 to 3 centimeters off the midline. Because spinal stenosis often affects multiple segments due to degeneration, the midline decompression approach offers a distinct advantage. It allows access from the center while providing visibility of both left and right nerves during surgery. This technique provides excellent surgical visibility and requires minimal bone removal, resulting in a very short operation time. For a single level, decompression can typically be completed in just 10 to 20 minutes. This makes it possible to safely perform multilevel spinal fusion in a short time without the need for blood transfusions. When treating spinal stenosis, if there is no instability, we begin with endoscopic or simple decompression. If there is some instability but not severe, we use the midline approach to preserve normal structures and minimize the risk of postoperative instability. At the same time, we reinforce the spine with spinal ligament reconstruction using an artificial ligament, which provides additional stability. Artificial ligaments have been used safely for over 40 years. They are commonly used for ligament injuries in the knee or shoulder. At Wooridul, we have adapted and optimized them specifically for the spine through extensive biomechanical testing. Our accumulated expertise and research allow us to use these ligaments more effectively and safely than most other institutions. As society continues to age rapidly, the number of patients with spinal stenosis is expected to rise sharply. Understandably, people feel uncertain or fearful about spinal surgery. However, the use of minimally invasive techniques has significantly reduced the need for extensive spinal fusion procedures. Today, surgical techniques that minimize damage to normal tissues and improve postoperative stability are advancing rapidly. Even elderly patients with multilevel spinal stenosis can now be treated safely and effectively. I believe surgical techniques, including spinal ligament reconstruction, will continue to evolve. If you are in pain, please don't hesitate out of fear. Consult a physician and pursue active treatment. Thank you.